Morning, Mr. Wax.
Morning.
How you doing this morning?
Pretty good. A little bit of pain.
Yeah? Where's your pain at today?
In my right knee.
In your right knee. If you were to describe your pain, what would it be? Like, is it throbbing? Is it like?
It's just
what's it like?
Sharp throbbing pain.
Sharp throbbing pain.
Yeah.
On a scale of 1 to 10, where would it be at?
About 8.
About an 8. Okay. So for your medication regimen on your chart, I got some Motrin, which is also known as ibuprofen. It's going to help reduce that pain. The medication class for that is NSAID, which is a non-steroidal anti-inflammatory drug, which, like I said, it helps reduce that pain. Do you have any history of allergic reactions, hypersensitivity, anything like that?
I do not.
Nothing? Do you have any GI bleeding?
I do not.
Any active GI bleeding?
No.
Okay. Do you have any history of ulcer disease?
No.
What about kidney failure?
No.
Any coronary artery bypass grafts within the last year?
None.
Okay. Any history of heart attacks?
None.
Okay. So, I think this is your medical history checks out. So after giving this medication, we're going to monitor your BUN. We're going to monitor your creatinine levels. We're going to monitor your CBCs. We're also going to make sure what your I's and O's are good. So whatever goes in must come out. Make sure you're peeing really good. So with this medication, you also want to take it with food because it might cause a GI upset. So remember, when you're taking this food, or when you're taking this medication, take it with food.
Okay.
Okay. Have you consumed any alcohol within the last week?
No.
No? Okay. So the assessment did not show any contraindications to giving this med. So we're going to take this dose, or we're going to take one dose, and then you can take another dose in about 4 to 6 hours.
Okay.
Okay. And this is for the acute pain in the right knee. So before I give you this med, I got to do the 5 rights. So can you tell me your name and date of birth?
Leo Knox, 10/22/05.
Okay. Bracelet's good. Okay. So we're giving this med at 0700. This is going to be by mouth. We're giving 350 milligrams of Motrin / ibuprofen. And before I give you this med, I got to name off some adverse effects.
Okay.
So some adverse effects of this drug could be Stevens-Johnson syndrome, which is a widespread rash, sloughing of the skin. It's pretty serious. So if that happens, make sure you stop the medication, you notify your provider, and go to your local ER or seek any medical attention as soon as possible because it is life-threatening. You're going to, also another one is toxic epidermic necrolysis, which is also just like a rash and like, sloughing the skin. It's pretty rough too. It's also life-threatening. So like I said before, notify your provider, stop the medication, go to your local ER, seek medical attention. And the last one is exfoliative dermatitis, which is just redness of the skin, and it's scaling of the skin as well, peeling. So like I said, this is also life-threatening. Stop the medication, notify provider, and then seek medical attention.
Okay.
And then this medication should decrease your pain in 1 to 2 hours. So hopefully you see that pain relief in 1 to 2 hours.
Okay.
Hopefully that's good for you. So the patient understands all the teachings, all the adverse effects, and this medication is safe to give.